everybody. Good evening. Thank you so much for joining us today. I'm your host of tonight's National Keratoconus Foundation webinar that will be presented to you all by Dr. Susan Gromacki. The title of the webinar tonight is Systems and Solutions for Your Contact Lenses. Can't think of a better person to present this. Every time I talk to Susan, I feel like I learn something new. She's really impressive. Dr. Ed Bennett, who is the director of the GPLI Institute, actually named Dr. Gromacki one of the profession's two experts in contact lens care, and rightly so, because she's been invited to present on contact lens care and compliance to the US FDA and FTC, and all around the world, in fact. Over 10 pages of her CV are dedicated to lectures and publications that she has presented on this topic. And she has served as contributing editor of Contact Lens Spectrum for 14 years and Contact Lenses Today for 7, authoring many columns dedicated to contact lens care in both publications. In the past, she was a faculty member at the New England College of Optometry and the University of Michigan Medical School, Department of Ophthalmology. She has a very busy practice dedicated to keratoconus and specialty contact lenses, and she's received almost 50 professional awards for excellence, including the Top Doctor of 2024 from the National Keratoconus Foundation, the Albert Nelson Marquis Lifetime Achievement Award, the world's top optometrist, and many other things. And so really excited to hear Dr. Gromacki's lecture today. And of course, everybody out there, feel free to type in your questions into the chat box and we will get to them towards the end of the talk.
Thank you, Dr. Lee. As you can see, I have disclosures here. I've consulted with many companies, spoken for many of them, but I have absolutely no financial interest in anything I will be talking about tonight. Before I get started, I just want to thank three groups of people. First of all, I want to thank Mary and the National Keratoconus Foundation for inviting me to present tonight, but most importantly, for their commitment to keratoconus and educating not only you patients, but also us doctors and all of our staff. They're amazing, as you know. So I want to thank them. Secondly, I want to thank Dr. Lee for taking her time to moderate this evening. And most importantly, I want to thank all of you for coming. It's very important to know how to care for your contact lenses because, as you know, many of these contact lenses are miraculous. They can restore vision to your eyes if you have keratoconus that perhaps you never thought you had. And it's just a joy for me to do this every day in my clinic, in my practice. And the thing is, these little miraculous pieces of plastic can't do their job without being cared for properly, and honestly, sometimes without being inserted and removed properly. I have patients that really struggle with that, and if they're not able to do it, they can't gain the benefits of this. So this is a very important topic, sometimes overlooked by doctors. We focus on the more scientific things, the fitting of the lenses, the health of the eyes, but if there's some link that's missing, such as the care of the contact lenses, it could make or break success, as you know. So, quick review of cleaning systems. Chemical cleaning systems include hydrogen peroxide, which we'll talk about in a minute. You need a neutralizer because obviously hydrogen peroxide is a fantastic disinfectant. It will kill just about everything: viruses, bacteria, fungi, even amoeba, which are present in tap water and all different types of water, bodies of water. So it's fantastic, but it has to be neutralized. Otherwise, it will very much sting the cornea. Multi-purpose solutions are all in one. All the ingredients that we need are mixed into one bottle. We'll talk about them too. Daily cleaner is important sometimes. We'll talk about that. A disinfectant, obviously, we need to kill the microorganisms that are ubiquitous in our environment. Enzymatic cleaners still do exist, and many of my patients use them. They remove protein from the contact lenses. Where does the protein come from? It comes from our tears, and then it can deposit on these lenses, causing discomfort and also affecting vision. Rewetting drops are important. I won't talk about them too much tonight, but they are important to rewet the lens, especially if a patient has dry eye. This contribution of the elements test is an old test that was put forth by the FDA decades ago. And in order for a contact lens solution to pass the FDA stringent requirements to make it onto the market, we have 3 steps that are important: cleaning, rinsing, and disinfection. All 3 have to be present. The digital rubbing, the actual cleaning of that contact lens, removes 1 to 3 log units, which is about 90 to 99% of that surface debris. What is that debris you need to remove? Well, there's protein from the tears, and there's lots of allergens from the environment, especially at this time of the year in the spring. We have pollen in the air, we have pollution all the time in some big cities. These types of things do deposit on our contact lenses, so they need to be rubbed off every single night. One thing that my technicians and I ask patients at every single visit is, how do you care for your lenses? And if they are using something that needs to have a rubbing step, we want to hear, I rub the lens in the palm of my hand. That's very, very important, because if you just take the lens out and you drop it into the solution without rubbing it, you still have 90 to 99% of that junk on that lens that's been depositing on there all day long. Then after you rub it, you want to rinse the stuff off, because you have these pathogens and such that you literally just rubbed off, and you have to dislodge them and get rid of them with a nice rinsing step. And then if you miss either one, you will absolutely reduce the disinfection efficacy. So when the FDA tests a solution, they test it per the protocol. They don't test it just taking the lens out and dropping it in the solution. The solution would never pass that. You have to remove the debris first. And this is good for both soft and gas permeable GP lenses. Let's talk about solution components. I'll breeze through this. It's a little bit scientific, but it's important to know that solutions are complex. They have been devised by chemists. There are millions of dollars that have gone into the research and development of these solutions to be what they are today. And they've gotten better and better over time. We've had some outbreaks of acanthamoeba, fusarium keratitis, that happened because the solutions really weren't that great. And somehow they still pass through the FDA's process. These solutions have been removed from the market. No need to worry about that. But part of it was non-compliance with these solutions. They passed through the FDA's process because, like I said, when the FDA requires testing, it is by the book. It is exactly as it states on the package insert. And unfortunately, many of our patients are not doing that, and that's where a lot of these outbreaks happened. But what's part of a solution? The biocide, disinfectant, preservative, those are your active ingredients. That's what's going to kill the bacteria, viruses, etc. Buffers, salts, cleaning agents, chelating agents, demulcents, and wetting agents are all included in these formulations. Let's go over each one of them quickly. So your disinfectant, which is often your preservative in the bottle, prevents contamination by microorganisms within that bottle, so that bottle won't spoil. You can use it for several days, a month. Um, the disinfectant will also kill the microorganisms, for example, the bacteria and the fungi. So examples of these types of things: hydrogen peroxide, PHMB, polyquaternium-1, alexidine. You'll see these names on the side of the bottle, and each bottle is a little bit different. We'll talk about that in a minute. What does a buffer do? Buffer is very important because you need to keep the pH close to the natural tears. There will be oftentimes this solution remaining on the lens when we put it in the eye, so it has to match the tears. Otherwise, it's going to cause some issue there, some biocompatibility issue, and you'll have red eyes and stinging, and it won't be very good. So examples: borate, phosphate, nitrate, bicarbonate, citrate. Those are just names of buffers. Sometimes there's a salt in there. That makes the solution isotonic with the tears. 0.9% sodium chloride is what we're looking at to match our tears. Cleaning agents that can remove protein, lipids. Lipids also come from our tears. Mucin are in our tears. That's a layer of our tears. And debris from the contact lens. Examples of cleaning agents: isopropyl alcohol, sodium citrate, sodium borate, sodium phosphate, polyvinyl alcohol, polaxamor 407. These are all proprietary things that are part of different types of contact lens cleaning agents. A chelating agent prevents calcium-bound proteins from depositing on the lens surface. So this can enhance disinfection. Obviously, if you have lots of protein depositing on your contact lens, it does prevent the disinfectant from doing its thing because it can't penetrate through it. So you need sometimes to add this chelating agent to aid. A demulcent can enhance comfortable contact lens insertion, for example, propylene glycol, and wetting agents are included in here too because it's very important to be comfortable, to be compatible with the tears. Also lubricates the lens surface. So hyaluronic acid, you hear those commercials on TV, that's a hot one. You see all these Jennifer Anistons and all these people talking about Eva Longoria. Hyaluronic acid, it is something that is very, very good as a wetting agent, and a lot of the companies are now incorporating it into contact lens solutions. But you can see the list there. There are lots of different types there of wetting agents. Let's start with soft contact lenses. If you're watching this webinar, you likely have keratoconus. And if you're wearing soft contact lenses and you have keratoconus, it's probably a very special lens. It may just be an off-the-rack lens, but probably not. It's probably a very special lens. Because of this, these lenses may be a little bit thicker than your typical contact lens to correct your keratoconus, and they may have lots of astigmatism correction to correct your keratoconus, so perhaps these lenses are not daily disposable. There's a couple reasons. With my keratoconus patients who wear soft lenses, I only recommend hydrogen peroxide. That's it. We'll talk about that in a little bit greater detail. But this is the thing about soft contact lenses. Soft contact lenses are like little sponges. They have water in them. They have water content. And they have agents which do soak up preservatives. And there was actually an outbreak years ago because with soft lenses, not keratoconus patients, this particular solution and this particular soft lens material, the material was soaking up the solution, leaching it back out into the tear layer, which eventually got into the cornea and caused some issues with the cornea. So that combination is now off the market. But that's what can happen. Preservatives do get into the matrix of the soft lens, and then they release into your tear film and they can irritate your cornea. That is something that's 100% still there, even though that one solution is off the market. So hydrogen peroxide is great because it doesn't have a true preservative. It's a disinfectant, and then we'll talk about in a minute. If you use it, you know what I'm talking about. It has a special basket-like case with a special disc. The disc neutralizes it, so in the morning it's just saline. That's it. So it eliminates the preservatives from the system. The other thing is very recent study I just saw in the literature from December of last year showing proof that allergies and keratoconus truly do go hand in hand. And we always knew this, but this is an excellent study that just came out. So with your cornea as a keratoconus patient being different and your eyes being more prone to allergies than someone who doesn't have keratoconus, you really don't want to use a soft multi-purpose solution. You don't want all those preservatives in there that can, frankly, cause issues with your ocular structures. Now, gas permeable lenses are different. The other thing we do not say in my practice is hard. And I think Ed Bennett was mentioned earlier by Dr. Lee. He's the chair of the Gas Permeable Lens Institute. I think, he would agree with that. The lenses used to be hard. The material is called polymethyl methacrylate. Some of you still might be in it. Believe it or not, they still make it. That material lets zero oxygen through. Gas permeable materials are extremely healthy. They let lots of oxygen through. They are extremely healthy. And that's why we can have scleral lenses, which cover the entire cornea. Years ago, we couldn't have scleral lenses because those materials were not healthy enough. We needed to make the lenses very small so the oxygen could get in around the lens. But now they're great materials. The oxygen goes right through. So gas permeable lenses are different because even though they do let oxygen through, they don't absorb the preservatives in the solution. Now, same goes for tap water. We do not want to use tap water with soft lenses because the amoeba that are present in the tap water, even our drinking water, can penetrate the matrix of a soft contact lens. So we do not want to use tap water with soft contact lenses. If you go on the FDA's website, they will tell you not to use tap water with any contact lenses at all. And honestly, for the little GP corneal lenses that are moving all around, it would probably flush out anything that was in tap water. But scleral lenses do not. As I have here, scleral lenses embed into the conjunctiva, scleras underneath. They do not allow much tear exchange, so we don't want to use tap water with scleral lenses for that reason. Otherwise, you're trapping potential amoeba up against your cornea all day. That's not a good thing. Hydrogen peroxide, a little bit about it, a little bit about the chemistry of it. It is toxic to the DNA of microbes. It gets right down to it. It can also break protein and lipid bonds, affecting microbial cell structures, and remove debris, both on the lens surface and even trapped. The disc, of course, that's right there on the basket type case. It will neutralize the hydrogen peroxide to non-preserved saline. It takes about 6 hours to do that. So, of course, you want to do this overnight. Technically, there's no need to rinse the lens in the morning, but I will say if that disc is more than 3 months old, it's probably not completely effective. There might be a little residual hydrogen peroxide there. There might be a little bit anyway. Some people do like to rinse the lens in the morning, but most people don't have to. Keep in mind, this is now non-preserved saline. So it will start to grow stuff because there's no preservative in there to kill the microbes. Now, because it's tight, shut tightly, you can keep the lenses in there for 7 days for the most part. We'll talk about another brand that's not, but most of the current brands, 7 days. Now, if you do open it up, then that's it. You've kind of broken the sterility of that situation. Also, hydrogen peroxide isn't the greatest for part-time wearers because if you only wear your lenses once a month, you're going to have to dump it out and re-disinfect it every 7 days. The most popular hydrogen peroxide now on the market is ClearCare by Alcon. 3% hydrogen peroxide. It's a no rub. If you use this, you know how it works. There's bubbles that are great. They dislodge a lot of the debris. But you do need to rinse it first to dislodge the debris kind of ahead of time. Rinse both sides through the basket case. It's a no rub though for soft contact lenses only, not for gas permeable lenses. It does have a cleaning agent in it, and the maximum storage again is 7 days. There's also ClearCare Plus. The difference with this one is it has a wetting agent in it. So this is the same as the Pure Moist, the Optifree Pure Moist. With this one, when they submitted to the FDA, they actually got a no rub approval for gas permeable. So as long as you take your solution and you rinse each side of the basket case to dislodge the debris, you don't physically have to rub your contact lens in your hand. But the previous one, if you wear gas permeable lenses, you do have to rub your contact lens with something, even if it's just saline, to get rid of all that debris prior to disinfection. There's a third one here. It's not quite as popular, also 3% hydrogen peroxide. Same as ClearCare for the most part. You'll see the case is pretty similar. This one's only for soft lenses. It's not for gas permeable. And this is only for soft lenses. Right there on the bottle, you'll see replaced 30 days or less. So this may not be your lenses. If you're wearing like a Novacone or something like that, a 3-month lens, this is not going to be for you. If it's 1 month or less, this is fine. Note, a lot of these hydrogen peroxides have that red cap on the top, which means you cannot put it directly into your eye. It does need to be neutralized to be able to be safe to wear. This is also no rub, but again, each lens needs to be rinsed for 5 seconds. And when they say 5 seconds, they mean it. That's how it's approved by the FDA. So a quick rinse is not going to cut it with this. You have to count 1, 1,000, 2, 1,000, 3, 1,000. So there's great potential for misuse because I think a lot of people aren't going to do that. The other issue with this one is the maximum storage is only 24 hours. So yeah, I would think that would be about right when the microbes would start to grow, but ClearCare does have a 7-day approval. If you ever used Ultra Care, it's off the market. Used to be originally an Allergan product, then AMO, then J&J bought it. J&J recently discontinued this one and all of their solutions in December of 2023. Okay, can you substitute the brown bottle? So today I just was Googling just because I wanted to see what you guys go through when you're looking for products. And believe it or not, when I Googled hydrogen peroxide for contact lenses, this came up. And I've written an article about this in 2012. It's no different. This is not cleared by the FDA for ophthalmic use because, unlike the other three I mentioned, it's not microfiltered, it's not purified, and it's not sterile. It may also contain heavy metals or stabilizers, not suitable for ophthalmic use. It may discolor contact lenses. And these impurities and stabilizers will remain after neutralization. It may vary in percentage, so it's not going to be necessarily 3% like the others are. And there's no disc included with it, so you have to buy the clear care anyway to have your case with the disc. It's hypotonic, which may cause lenses to bind to the cornea upon insertion. That's not healthy. And it's not buffered. The pH can be as low as 7.5. It needs to be around, or 3.5. It needs to be around 7. So all of this means that the disinfection and the neutralization may be inconsistent or inadequate, leading to burning, stinging, lens discoloration, and other problems. The other thing is it doesn't contain any surfactants, which aid in the cleaning and comfort of the contact lenses, which the other ones do include. So this is not a good idea, despite what the internet says. Okay, on the same sort of topic, private label solutions, the generics. Has your doctor ever given you a sample of a generic? Of course not, because the generics, they're not the same as what the doctor has recommended, and your doctor has thought pretty thoughtfully about what is best for your lens in combination with your eye health. In addition, not all generic solutions are the same. They're not the same as the name brand, and they're not the same as each other. This is the thing. They're not even the same if you have two bottles sitting side by side on the shelf of your big box store. That one bottle, same label, may be completely different solution than the bottle sitting next to it. And why is that? Because every year a retailer will entertain bids on which company will produce and package its private label solution. So, for example, Walmart will accept the lowest bidder. And then companies tend not to place their best solutions. Why would they? Why would they sell their best solution to Walmart or Kmart, if Kmart's still even existing, or Target, for pennies on the dollar when they have spent millions of dollars developing this solution? They're not going to do that. They will give you their 10-year-old solution, their 20-year-old solution. That's what they're going to sell to Walmart for pennies on the dollar. And then what happens with Walmart? They decide, this one's cheaper next year, so the contract changes. Well, expiration dates on the labels, they're good for about 18 to 36 months in the future. So there could be two different chemical formulations residing in two of the very same bottles sitting on the supermarket shelf. Or vice versa, I have gone into, I love the store Meijer. We used to live in Michigan, and I love Meijer. If any of you live there, fantastic. Well, what Meijer does is they have one multi-purpose solution, and they label it with all the different color labels of all the name brands. So they've got a green one and a blue one and one with like a yellow sun, and all the different name brands, the same solution. And it's not equivalent to any of them, but wow, what advertising. That's somehow they can get away with that. But that's why I'm reticent to recommend private label solutions. Now, if a patient wants to bring one in, I'll look at the bottle and make sure that it's a safe and effective product. That's great. But you're kind of really taking a chance when you go into using a private label or generic solution. Next, who needs a daily cleaner? Because we talked about the rubbing, rinsing, and then disinfection. Some people do need a daily cleaner. I will tell you, there are not many left, but there's enough for people who need one. It's those soft contact lens wearers who do replace their lenses every 3 or more months. The multi-purpose solutions probably aren't going to be the best. Or the heavy depositors. So right now we've got, for soft lenses, Sensitive Eyes Daily Cleaner by Bausch & Lomb and the isopropyl alcohol-based cleaners. You may remember, if you've been wearing soft lenses for a long time, there was one called Miraflow. That was by Ciba Vision, who was bought out by Alcon. My patients loved it because these remove lipid deposits. And some people's tears really deposit that lipid readily. It's just your personal makeup, how it is. And also, it could be the material of the contact lens. Certain materials do, silicone hydrogel is one of them. It does deposit lipid a little bit more readily than protein. So these are awesome to remove lip deposits. So Miraflow The original MiraFlow is now off the market. There is actually another MiraFlow. It's not identical to that formulation. You can get it online. It was interesting. Yesterday, I sat down with a patient. She's a scleral lens wearer, and Boston Daily Cleaner was just not getting off her lipid deposition. And we went online together right there at the exam room, and I Googled this MiraFlow, and it said that um, it was only available to doctors. But it was interesting because she went online and she got it, and they didn't ask if she was a doctor or not. So she's going to use this. There's a couple others that are the same formulation. One is Serene, and one is Lens Fresh. And these are really, really great for soft contact lenses. I will say some gas permeable lens materials, they may not be that compatible. So just ask your doctor about it, because some of our very high, what we call DK, it's how oxygen permeable the lens is. Some of those plastics are a little softer than others, and we want to be careful that this isopropyl alcohol doesn't damage the plastic. So just ask your doctor about it. But these are really great for soft lenses to really wipe off any debris that might be there. All right, most of you, if you have keratoconus, are probably wearing gas permeable contact lenses, because that is for moderate and higher levels of keratoconus, your best bet on seeing your best. So let's talk about gas permeable corneal and scleral contact lens care. So we do have daily cleaners. Daily cleaners are very important, even in gas permeable lenses, because we do need to remove the debris. People always ask me, what's the difference between Boston? And they used to call it original, it may still be on there. And then they took off the original, and I think they put it back on there again in advance. The Boston original is more abrasive. The Boston Advance is less abrasive. Sometimes we do get some care kits in our office, sometimes we don't. And if we do, it's always the Boston Advance, because the original cleaner might be a little bit too abrasive for some of our materials now that we're using in scleral lenses that have extremely high permeability to oxygen. Also, you can use the isopropyl alcohol-based cleaners. They are non-abrasive, but you do want to be kind of careful with that. Lots of my patients use enzymatic cleaners. Enzymatic cleaners are great because they remove protein. And this is really the only one that's left that's pretty easy to get, and it's the Boston One Step Liquid Enzymatic Cleaner by B&L. Basically, you just drop it into your solution at night, 1 day a week, and my patients love it. They really swear by it, and it's fantastic. Just be careful, you have to rinse it off profusely because it is pretty strong. Used to be, we had an Ultrazyme, which was great to use with clear care or hydrogen peroxide. That's been discontinued again in December. And we used to have this Opti-Free Super Cleanse, which was good for soft lenses. That has now also been discontinued. So the reason why they're discontinuing these is most soft lens wearers are wearing disposable lenses, whether they're daily disposable or every 2 weeks, 1 month at the most. So there's not a lot of need for this for them. But for my keratoconus patients and gas permeable lenses, absolutely they're using this Boston protein removal. The rinsing step. So we talked about rubbing, rinsing, disinfection. The rinsing step, you generally just want to use saline, okay? Because you don't really need to use multi-purpose solution. That's overkill. And then again, you're introducing all those preservatives into the mix. As I mentioned, the FDA does not want you to expose your contact lenses to any water, tap, bottle, distilled, lake, or ocean. That is the safest way to go. So saline can be preserved, can be non-preserved. Problem with the large bottles like Purolens, I am against this 100% because they are large bottles and they are not preserved. So they are like 3 or 4 ounces and there's no preservative. As soon as it's opened, you've broken the sterility, it will start to grow stuff. I'll tell you about a good study later that proves that. You can use aerosol saline. I don't see that a whole lot anymore, but that's always good. Or you can use the unit dose like the Addipack. You may use that to fill your scleral lenses. It's expensive, and because of this, some of my patients don't want to use it up for rinsing. And then what happens is there's daily cleaner on there, and then it's going to stink. So, personal preference, but saline is definitely the way to go. Water is not the best idea. Disinfection. We do have options. Here are multi-purpose solutions. So with these three, meaning multi-purpose, the cleaner is built right in. They require a digital rub every single night. Unique pH by Menicon, Boston Simplus, and Tangible Clean. All three are different. Then we have our systems. So we have our Boston Original system. That includes both, whoops, I was trying to use the cursor here, the daily cleaner and the disinfectant. Boston Advance also has a daily cleaner and a disinfectant. Optimum, now you probably know this, it's been discontinued. It's been discontinued for a long time. I'll show you what their website is. I accessed it yesterday for the purpose of this lecture just to see if they said any different. Nope, same verbiage. It's been the same verbiage for at least 2 years now, but I'll read it to you and see what they say. They do leave the door open. Equate by Walmart. Again, it's a generic, but a lot of my patients do find good success with this one. This is interesting. This Menicon Progent never used to be available to patients because it is so incredibly strong. It was previously available in the US for in-office use only to really get rid of a lot of those stubborn deposits. But now it is FDA cleared for home use with practitioner approval. So what they recommend, Menicon is a system where you use unique pH, the multi-purpose solution, to rub and rinse and soak. And then every other week, you use this Menicon Progent. You may or may not have heard about this. I don't recommend this to my patients simply because it's complicated. You have to mix vials A and B. A is sodium hypochlorite, B is potassium bromide. Then you wait 30 minutes. Then you must rinse it off profusely. And now if you have scleral lenses, you have to use a larger case. Notice this is a basket type case, but it doesn't need a disc because it's not hydrogen peroxide we're dealing with. It's sodium hypochlorite. Maybe some of you chemists out there know what this is. It is bleach. So I don't want any of my patients mistakenly putting bleach in their eye, or if it just doesn't rinse off all the way. This is really toxic to the cornea. So this is not something I recommend, but know that it's out there for people who are really heavy depositors. Hydrogen peroxide is approved for gas permeable, just the clear care though. Remember what I said before, that the regular clear care, not the Hydroglide, not the Plus, is only a no rub for soft contact lenses only. For gas permeable, you have to rub your lenses first. You could rub it with hydrogen peroxide if you don't mind having some on your fingers. It can discolor your hands. But a lot of people just use saline for that rubbing step. Now, Clear Care Plus is a no rub approved solution for both soft and gas permeable, but per the directions you will see requires a 5-second rinse. So you have to rinse it. You can't just take the lenses out and put it in the case. That's not how it was approved by the FDA. That's not going to be extremely helpful for you. Okay, so let's summarize this because these are all different. I'll talk about a little bit later the importance of good staff. I have great staff and I've trained them because they are an extension of me. I want them to communicate to my patients just as I would, and they do. And that's so important to a practice. And I'm sure you know that. Some of you have probably been to multiple practices and you can see the difference. It's similar when I go to the dentist. If that dental hygienist isn't doing a good job or isn't nice or friendly, that's going to cloud my view of the whole operation. And it's the same. It's extremely critical for a top practice like mine, where I do this all day, every day, to have excellent staff, and I have excellent staff. And I filled in at this one ophthalmology practice once when I was busy. I was seeing a patient, and I heard the technician say to the patient, all solutions are the same. And I'm thinking, they never really truly got trained, because this is going to tell you they're not all the same. Boston Advanced Conditioning. Here is what is in there. Chlorhexidine gluconate, 0.003%. Polyimidopropyl biguanide, 0.0005%. And acetate disodium, 0.05%. Boston Original, not the same as Advanced. It's chlorhexidine gluconate, but look at the percentage. It is higher. So it is a stronger solution. ED disodium, 0.05%. Well, stronger in certain respects, stronger in that particular chemical. But I will say the Boston Advanced does have the polyaminopropyl biguanide added to it. So it's kind of personal preference. But years ago, the Boston Advanced, when it just came out, it was much stronger than the original. And they had to back it down because it was causing toxicity. So now, I guess you could, which one's stronger? It just depends. The equate. Okay, so what is in equate? Chlorhexidine gluconate, 0.003%, very similar to Boston Advanced. Polyminopropyl biguanide, ED disodium, but look at the difference. It has BAK. BAK is benzalkonium chloride. That is a very toxic, in a higher concentration, not in this one, but it can be very, very toxic to the cornea. In fact, a lot of soft lens solutions, it's been removed forever. And it is sometimes present in some medications, some eye medications. And they leave it in there on purpose because if you can erode a little bit of that epithelium, it helps the medicine penetrate a little bit better. So the equate on the surface looks like, very similar to Boston Advanced. Yeah, it is, except it has BAK. Unique pH has polyquat, polyquaternium 1.0011%. It has EDTA, hydroxyl guar, which is a wetting agent, and it has PEG, which is a wetting agent too. Tangible Clean has polyhexanide, 0.001%. So they're all a little bit different. Here's Boston Simplus. Boston Simplus is a multi-purpose. So it is different than Advanced and it's different than Original in that it has a cleaning agent in it. But as you can see, kind of similar to Advanced, right? 0.003% chlorhexidine, 0.0005% polyminopropyl biguanide. But it also has polaxamine in it. They don't. It also has HAP for protein removal, which the other ones don't. Some of my patients, though, they still need an enzymatic cleaner, even if they're using Boston Simplus. It's not really enough for some people. Then it has a wetting and cushioning agent. And then this is the interesting thing about Boston Simplus. To this day, they still have on their packaging that they recommend a morning rub and rinse. I still, to my patients, recommend an evening rub because what you want to do for that solution to cut through all the debris that's been depositing all day, it's not strong enough to do that. If it was, it'd have a red cap and it couldn't go in your eye. These can go right into your eye. Would you want to put them right into your eye? Probably not, but they're safe enough to do that. So I want my patients to rub the lens at night, get off all that debris so the solution can do its thing. Many of my patients over the years have used Optimum by Lobop. It is fantastic. It has 3 parts to it: a cleaner, a soaking, and a wetting agent. Unfortunately, as many of you know, it is currently unavailable. I won't say it's discontinued. That's a pretty strong word. And the reason is I got this from their website yesterday. Our contract manufacturer is undergoing facility changes. Again, this has been going on for a couple of years. And have stopped, bad grammar, production of our solutions. Our manufacturer has not given us a time frame for when to expect a restock, nor do we have any idea, as this solution is completely out of our control. I mean, it's a little bit under your control because you could have by this time maybe found another manufacturer. I would think you could void that contract since they're not doing it. Yeah, it's too bad, because I'm thinking of the patient that I was sitting down with yesterday and going online looking at that MiraFlow. She used to use this and she never had her lipid deposition. And this was tremendous stuff. And I hope it goes back on the market because it definitely had a niche. Not a huge market share, and that's probably part of, I'm guessing, part of the issue is that it's an economic decision as well. And then question 2, how will I know when Lobop will be back in stock? It really didn't have any answer there. So just keep tabs on it. The website is still up and running, as I found yesterday. So it's never say never. It still could come back. Perhaps another company will purchase it. Perhaps not. If they purchase it from Lobob, maybe they'll bring it back to market. That would be a good thing. What can you do if you're a heavy depositor? Enzymatic cleaners, Progent, as I mentioned. If your doctor is like me and they specialize in this, they fit keratoconus patients all day, every day. They will have a polishing or modification unit. If they dabble in keratoconus, they will not. They will absolutely not. So your doctor can literally polish off those deposits and or clean with a very strong cleaner that only doctors can purchase because again, it's something that some of these manufacturers would not want in the hands of some patients who might drop it in their eye. It's called Boston Laboratory Cleaner. It's extremely toxic to the cornea, but it does cut through a lot of debris. Or an alcohol-based cleaner might do it. It certainly might take off that debris. Now, if it's before the deposits, your doctor can order the lens with a coating called tangible hydropeg. What is tangible hydropeg? It's a coating that literally envelops the entire lens. So after the lens is created, it's microfiltered and cleaned. It's called a plasma treatment, and then literally dipped into this coating, and the coating adheres to the lens. It's very, very soft. It's a gel-like coating. It's 90% water. So if you can imagine, it is super soft. And it does, with the manufacturing process, integrates into the contact lens, and that way the lens with that 90% water coating can integrate seamlessly into the tear film. This is a great thing for people with dry eye. It improves wettability, increases surface water retention, increases lubricity, and as I was mentioning, reduces deposits, can also reduce some scleral fogging. This has all been proved. These are claims they make through the FDA. So your doctor can order this ahead of time if you're a heavy depositor. However, it's warranted for 1 year, and I have seen it rub off a lot sooner than that. And how I know it's rubbed off is if I see a scratch on the lens, then I know it's rubbed off. When I look at the lens through the slit lamp, the biomicroscope, it's my big tool that you know your doctors are using to check your lenses and your eye health. If I see a scratch, I know that it's rubbed off in that spot. Companies, the labs, they don't really want to replace it because they have to remake the lens, especially after COVID. They don't want to deal with taking a lens out and re-disinfecting it and reapplying it. And they really can't reapply it anyway once that lens is scratched. It can only build onto an existing sort of layer of that. So anyway, this is important because it is so very soft and lubricious. If you have it on your lenses, you know what I'm talking about. They're very sort of slimy initially. You cannot use a daily cleaner. It'll wipe it right off. You can't use an alcohol-based cleaner. That will really wipe it right off. You cannot use an enzyme cleaner. You cannot use Progent. Or your doctor can't polish that lens. It'll polish it right off. Generic peroxides will rub it right off. And we'll talk about the testing that they went through in a minute, like what solutions can be used with it. But those generic peroxides, some of them are not safe enough with it. And 3 stars next to this one, tap water. Tap water contains minerals, which will rub it right off. So if you are used to running your lens under tap water and your doctor puts this coating on your lens, and they're probably going to charge you a little bit extra for it because frankly, they have to pay a little bit extra for it. Put it under tap water a few times, it'll be gone. It'll be gone in no time. So I would not recommend that. So when this came out, it was tested with all different solutions. And the ones that passed the testing that are compatible with a hydropeg are Unique pH, Boston Simplus, Tangible Clean. Those are all multi-purpose solutions. And then 2 hydrogen peroxides passed, Clear Care and Clear Care Plus. That is it. So if you have hydropeg on your lenses, this is your choice. These are your choices of what you can use that do not rub it off. Now we have something that came out a little bit later called Tangible Boost, made by the same company. And this includes a couple little tubes of the tangible HydroPeg polymers. And so it restores your coating. You can do this at home. It's only indicated for use on lenses that already have that little layer of treatment. So if it doesn't have tangible HydroPeg, it will not adhere to just the contact lens. If it had it and it's now rubbed off and there's scratches and such, it will not adhere. It has to kind of build onto a small layer that's already there. So it says it's monthly, but frankly, it's a little bit expensive in my book to do it every month. It's almost the cost of a GP lens. It's more than the cost of some GP lenses, honestly. So I tell my patients, do it in the first couple months, 2, 3 months, and then see how it's going. Perhaps every 3 months thereafter, perhaps every 6 months, but I would do it within the first, say, 2 or 3 months to ensure you get that second coating on there before you see any scratches or see it rubbing off. Now, let's talk about scleral contact lens care. Scleral contact lenses are absolutely amazing. They have provided such great benefit to so many of my patients. And they're different. They're fit different. It's a different fit than the corneal lens and the soft contact lenses. And the care has to be a little bit different as well. I've written quite a bit on this topic, as you can see. I mean, it was really my privilege years ago to be, one of the people who was kind of helping establish standard of care. Because when I started fitting scleral lenses 15 years ago, there wasn't anything written on them really. And many of us, myself, Greg Denaire, Chris Sint, so some of the earlier adopters in this really had to learn by the seat of our pants. And I actually, if I had questions, I would call Greg and say, hey, what do you do for this? And he gave me tips, little tips that you didn't even really see in the literature. And that's how I came up with a lot of my little tips that I ended up writing about and putting in the literature 10, 12 years ago. Okay, scleral lenses. If there's no HydroPeg coating, they need to be cleaned with a daily cleaner. They really should not be cleaned with a multi-purpose solution like Simplus or Menacon, Unique pH, because a couple reasons. One is if you have keratoconus, you need any bit of vision you can get, right? Every deposit that's on there is going to hurt your vision, and you want to get every deposit off of there. Secondly, a deposit, whether it's pollution, protein, a lipid, it's a little bit more solid and it prevents the oxygen from going through that contact lens. You need oxygen to go through that contact lens. We all need oxygen to our cornea. That's important, very important. If you stop the oxygen from getting to that lens, your cornea will swell, and that's not good. Little secret, your doctor may have told you, scleral lenses are 3 times the thickness of corneal GP lenses. They have to be made thicker, otherwise they would break, and they're expensive. We don't want them to break. We want them to last 1 to 3 years. Some of my patients, most of my patients do a great job cleaning their lenses because, again, my technician and I ask people on every single visit. If I know there's at least a couple of my patients on this, and they know, we ask them every time, how do you clean your lenses? Because it is so critical to success. And we have patients who have had their scleral lenses 7 or 8 years because they're doing such an amazing job cleaning them. So if there's protein built up on there, lipid, it will weaken the plastic and the lens will break sooner. And you don't want that. It's more expensive. But also, because that lens is 3 times the thickness, your scleral lens actually lets less oxygen through than the people in those little corneal GP lenses. Depending on the soft lens, soft lenses are different. There can be very high permeability materials and very low. Very high permeability materials are very similar to the corneal GP. The very low permeability soft materials, they let the least amount of oxygen through, even less than your scleral lens. So, but still, you want the maximum amount of oxygen getting into your cornea. So you want to get every deposit off of there. That's important. Also, if the deposit was a microbe, bacteria, virus, with a scleral lens with very little tear exchange there, you're trapping that pathogen up against your cornea all day, increasing the potential for infection. So I hope that was enough to convince you to use a daily cleaner every single night. Then rinse with saline. Preserved is okay. It's a little bit less expensive, the big bottle of preserved, than the little tiny ampules of non-preserved. Then you want to disinfect it. with your GP, or it can be multi-purpose, or it can be just the one of the Boston conditioning solutions. Now, if you have sensitive eyes, you can absolutely use Clear Care to disinfect because you're taking the preservatives out of the system. Keep in mind though, with Clear Care, if it's a large scleral lens, if it's greater than 16.6 millimeters in diameter, you might want to ask your doctor, you may or may not know, it may not fit in that basket type case. And I've fit enough of these. I have seen patients close that case and crack their contact lens. You'll see a little crack right in the middle there. That's not good. Then they have to buy another one, unless it's still under warranty. So your doctor should be looking at this and should be noting if you can use that Clear Care case or not. Also, if a patient has sensitive eyes, when you take it out in the morning, you want to rinse it with saline solution. If you don't have sensitive eyes, there's nothing wrong with keeping a little bit of that Boston conditioning on there, especially on the outside of the lens. It gives it a little bit of wettability. So if you do have a very large scleral lens, there's hope. There's something for you called the Pros case. As you can see on the right, it can fit a very, very, very large scleral lens, much larger than that Clear Care case. It really dwarfs it, doesn't it? I will say though, it doesn't come with a disc. So you have to buy the Clear Care case anyway, which most times is going to come in with your bottle of Clear Care in this day and age. Used to be years ago, you could buy it separate. You still probably can. But you have to pry the disc off the Clear Care case and put it into the Pros case. You can get this from dryeyeshop.com. Also, you can use a large Boston scleral lens case. And this can hold a scleral lens up to 23.5 millimeters in diameter and 10 millimeters in sagittal depth. So this can hold a very large lens. Now, most of the lenses I fit will house just perfectly in a regular Boston conditioning type lens case. But if you do happen to wear a large lens like the Pros, you might need this Boston scleral lens case.
Hey,
Filling
Dr.
the scleral
Gromacki.
lens. Yes, ma'am.
Hi. Oh, I mean, you're doing really great. I wanted to get to a few questions just in case we ran out of time tonight. There was a really interesting common question that we get about re-wetting drops, and patients were just wondering, what type of re-wetting drops should they use if they are wearing their scleral lenses during the day?
Yes, great question. Um, I recommend non-preserved artificial tears because, again, I don't want to introduce any preservative underneath the contact lens. And we do know that if the lenses are fitted properly, they should not be sealed tightly into the sclera. There should be a little bit of room there. And sometimes, as you know, some of you patients in the audience, sometimes there's debris that gets underneath. We call that
Hmm.
midday fogging. So I I would rather use a non-preserved artificial tear because most of the rewetting drops that you get, at your local pharmacy or whatever, they come in a bottle and they have preservative. Um, that's
Got it.
just my preference.
When we tell our patients to rub the lenses, do you usually tell the patients to rub just the outside or should they rub the inside of the bowl as well?
Yeah, great question. Believe it or not, most of the deposits happen on the outside because it's to things from the environment and the tear layer goes on the outside. But
Hmm.
sometimes you will see some deposits on the inside. So depending on the lens material, some of my patients do take a wetted Q-tip, like wet with saline or cleaning solution, and they actually get the inside of that lens as well. But generally, when you're rubbing the lens like this in the palm of your hand, you're going to get both. You're going to mostly get the outside, but your finger will get the inside a little bit too.
Yeah, agreed. It's definitely harder if you have some male patients where their fingers are just so large they really can't get in there. So I love
Yes,
that Q-tip
that or
trick.
the super long fingernails like my daughter had for prom, those.
Hmm.
It is tough to
Exactly.
really get that rub done properly with a
Yeah.
scleral lens.
So I have a lot of patients that tend to want to take a break from their sclerals for multiple reasons. When they take the lenses out, should they put the lens in solution or should they store it dry? What do you usually recommend?
Are you asking like taking a break during the day, but they're going to wear it again tomorrow?
Yes.
Okay.
Or maybe they want to wear it again in like an hour or two. Yeah.
Yeah, I mean, if it's an hour or two, saline is fine. I always would rather have them put it in preserved saline just to be safer. Multi-purpose solution is fine. Obviously, hydrogen peroxide is not because it takes 6 hours to neutralize. Um,
Hmm.
but yeah, they can really soak it in just about anything. But I would not soak it in non-preserved saline, what they're going to fill it with.
Yeah, agree. Because I guess you would be putting yourself at risk for microbes and whatnot. During the pandemic, I feel like finding a lot of solutions was really difficult, especially the hydrogen peroxide based solutions. Did you ever have patients coming in asking about wanting to use maybe like brown bottle peroxide from
Oh,
from
you're leading me into something I'm going to talk about later.
Oh, okay. Okay, amazing. So we'll table that for now. One other question. So someone was mentioning that they're very compliant and they get new sclerals every single year. How should they store the old scleral lenses and once the lenses are beyond 3 years old, should they continue to store the lenses or should they throw them away?
Oh my goodness, I have patients with lenses that I don't know how old they are and they're still great. So this is what I recommend. This is very important. As long as it doesn't have the hydropeg, because the hydropeg needs to interact with something wet to stay hydrophilic. But as long as it has
Hmm.
no
Hmm.
hydropeg, when you get your new pair of lenses, as long as your old pair, as your doctor said, they're still fitting well, the prescription might be off or something like that, or they might be a little bit scratched or what have you. As long as it's still a good fit, you want to put them through a cleaning and disinfection cycle overnight, and then in the morning you blot them dry and you store them dry. And the reason is if you store the backup lenses in solution, depending on what the solution brand is, for example, it could be a 30-day, for example, some of the Boston solutions are a 30-day storage max. So what happens is after about 30 days, that lens can start to grow stuff. And also, any of you who have done this know this, as the solution, even though it's closed, it can start to evaporate and you get this kind of nasty, like hard
Hmm.
solution that is around your case and can go on your lens. And then try and get that off, you could break your lens. So you definitely want to store the backup lenses dry as long as they don't have hydropeg.
Oh, yes, 100% I agree. Um, for some patients out there, I think what this person was alluding to maybe their current combination is Boston multi-cleaner and an enzymatic solution. How do you feel about that combination for a lens care regimen?
Well, it depends on what they mean by multi-cleaner. If it's the daily cleaner, you still have to soak it in something overnight. So you should soak it in one of the Boston solutions overnight.
And then one last question, because we talked about a lot of things can rub off hydropeg. Can a patient themselves physically rub off hydropeg if they're using the proper solutions?
If they get their fingernail in the way, they certainly can. I have patients that, they come back, for their 6 month check or yearly visit and the hydropeg is gone and they're like, but I didn't do anything wrong. And I'm like, you know what? Every time that lens hits the sink or the table or your fingernail clips it, it's soft. You can rub a little bit of it off.
And I kind of heard you mention how hydropeg, for you personally, you haven't really seen it last the full year. I agree too. Have you noticed any improvement in the length of how long that coating will last with Tangible Boost?
Oh, of course. Yeah, tangible boost will boost it. It certainly will. But the key is you have to get to it before the coating is gone because it will not adhere to a lens that isn't already coated. So you have to get to it within the first 2, 3 months before it's rubbed off.
Is hydropeg something that can be added to like a soft lens for patients?
It can be added to a hybrid lens, which we'll talk about hybrids briefly as well, the cleaning and care of them. But we we have some things for soft lenses that are very similar, but not that exact name brand tangible hydropeg.
Well, so our next webinar is going to be on July 9th. It's about Ask Us Anything. There's going to be questions that you all can submit. I'm not sure if we have run out of time in this program. I can't really tell if it's still recording. Um, but yeah, why don't we just continue the rest of the presentation?
All right, well, I'm going to keep going and I'll be quick. Filling the scleral lens is critical, has to be non-preserved. These are awesome. They're inexpensive. The Adipac saline vials, they are not FDA approved. They've never been tested with the FDA. However, I have patients that have been using it for 12, 15 years and they're doing great. So that's usually what we consider starting with because it's the cheapest. Now, these three things have been tested. They've passed through the FDA. They're basically the same thing as the Adipac, coming in different sizes, lacquer pure, sclerofill, vibrant view. But we know these are safe because they have been through all the testing. Now, other options. There was something called Unisol, which was a large bottle of non-preserved saline. Unisol, business decision, Alcon's like, not healthy, not good to fill a scleral lens. It was never developed for scleral lenses, and we're just going to pull it from the market because it's not a good idea to fill a scleral lens with something that comes in a 4-ounce bottle. Because even though it says it's good for 14 days, it will start to grow stuff immediately. Pure Lens Plus, never developed for use with scleral lenses. It was developed for this little UV system called Pure Lens. And it was developed for soft lenses. It was not developed for scleral lenses yet. When you Google filling scleral lens, what comes up first? Pure Lens. They must have a really good search engine. So I have patients that come in from other practices and they've got this bottle of Pure Lens, and I tell them right away, please stop using it. It will start to grow stuff. And there was this awesome study by Gloria Chu, who I will work with quite a bit on some keratoconus projects. And she had 35 patients and found 63% of those bottles were contaminated with 45 different microorganisms. So we know that this happens and it's just not safe and just not healthy. And actually last week, brand new patient came into me, referred in by a local ophthalmologist. They were seeing a different OD for the scleral lenses and brought in this non-preserved bottle. It wasn't even Pure Lens. It was just this generic saline non-preserved. And they said their last doctor told them that was okay. It's really not the best thing. Now, unit dose artificial tears, also not FDA approved, but I will tell you that I have patients that have been using certain brands of these for many, many years, and it is fantastic because this is for my dry eye patients and not so dry eye sometimes too, but this gives a little extra lubrication. It gives that patient like a moisture chamber. It traps that artificial tear against their cornea. And a lot of my patients say when they have this, it feels a lot better than when their contact lenses are out because they're giving themselves some protection. Neutrophil is fantastic. It's the closest thing we have to our actual tears. It's FDA approved, it's preservative free, and it contains all these different nutrients: calcium, magnesium, potassium, phosphate, sodium, pH, and osmolality match the tears. This is the best thing we have and most expensive. So I generally like to start less expensive, and if a patient either needs this upfront because of the health of their eyes, because of their ocular surface, because of dry eye, they get this right up front, and it is fantastic. Handling. Easy to get lenses in? Not really, right? If you're in the audience and you wear sclerals, you may have struggled with this, but there are lots of things to help us, including things like a large suction cup, which is what we have in my practice. We give the patient their first one, and then after that, they can purchase them. But what I do is I buy a huge bag of them, and I actually cut off the end because we do not want to use it as a suction cup. You don't want that lens to suction onto the suction cup. You want to relieve any suction, so there should be a hole in the bottom. The Easy Scleral lens applicator is nice, or just a little O-ring from the hardware store. And some of the labs have been putting these now into the little case they give the patient when they get their lens. And the patients are like, "What's that?" And I tell them, "Yeah, maybe just try it. Put it on your finger and then put the lens on." It's a possibility. This is fantastic. I love this. So many patients of mine, this has been the difference of being able to wear sclerals or not, because it has that LED light. All of this system has been run through the FDA, and it's been run through in wet environments, and it does well. Of course, it's going to be a wet environment because you're filling the lens with saline and you're cleaning it. It's going to be a wet environment. So this is a very safe thing. It doesn't short out. It's around $100. You can get it directly from Dalsy Adaptives. It's the sea green lens inserter. And this way you can use both hands to open up your eyelids. It's really great for some people who don't quite have the manual dexterity to insert the lens just the regular way. There's another one, much more expensive. This one's like $399 or 400 and something dollars. This one has not been through all of the FDA testing to prove that it doesn't short out or do well in wet environments. So it's out there, just to let you know, but it's not something that I generally recommend. Webinars, lots of great webinars out there. Here's a few that I've given over the years. Lots of good information. If you wear hybrids, hybrids are such a great invention because you have the benefit of the GP lens and the comfort of the soft. Problem is, there's a lot of non-compliance. This is what Synergize, now Cooper Vision, recommends. Digitally rub with a soft contact lens daily cleaner, not a gas permeable because you have a soft skirt. Rinse with saline. Then you can either use a soft multi-purpose solution or Clear Care. Clear Care is preferred, again, because you have that soft skirt, and the soft lens multi-purpose solution will be taken up by that soft skirt. Put it on your eye, leaches back out, now you have a red eye. This is the other thing I find that patients don't do. This is a 6-month replacement. This is not a yearly lens or year and a half. It's a 6-month replacement. And I find that patients don't replace it. The lens deposits, especially that soft skirt, and next thing you know, they have red eyes. Again, because of that soft skirt, gas permeable cleaners and solutions are contraindicated. And you can ask for hydropeg, and what the package insert says is no abrasive solutions, or else it'll rub it off. Travel tips. I always find traveling can be tough with scleral lenses. It can be really tough because you have a lot of different things, especially if you've got the daily cleaner, the saline rinse, the storage, the case, what you fill it with. So this is what the TSA has as their requirements. 311, 3-ounce or smaller containers of liquid or gel. So if you want to pass it through, it has to be 3 ounces or less. And then 1 quart-size bag holding your 3-ounce or smaller containers, and then 1 bag per traveler. Now, they will not pass through 3 ounces of solution in a 12-ounce bottle. I just had this conversation with my daughter who was traveling, and she's like, "Well, there's only about 3 ounces in it." I'm like, they won't do that. If I hadn't been an eye doctor and known this, I wouldn't have not known to tell you that, and they would have taken it. But yes, that doesn't count. It has to be a 3-ounce or less bottle. Please, please, please never do this. Do not transfer your solution from a large bottle to a small one that it did not come in. These bottles that advertise all this stuff online, $19.95, that is not cheap, right? This thing is not sterile. It never was sterile. It was not sterilized, so you're breaking the sterility of a sterile environment to put it in a non-sterile environment. Okay, so interestingly enough, I Googled this a few days ago, again for this lecture, and I had talked about this a couple years ago in a different lecture. And when I went on the website, it said TSA approved for air travel. Well, scratch that. It's no longer on there. So somebody got them in trouble. Full sterilization. Product has gone through a full laboratory test. No, not. It doesn't say that anymore. It says provides microbial protection. Wow. What does that even mean? So it's so funny though. You look at this and it has 2.8 out of 5 stars on Amazon. 35% of the people gave it 1 star. Why? Because it caused an infection? No, because it's the wrong color. Solution drained out and my contacts were ruined. Had to use a butter knife to open the lid. So, patients, I love it. They don't like this thing and it's for the wrong reason, but they're not using it, and that's a good thing. So what can you do? Purchase a travel size bottle? Yes. In fact, they're available at the airport. That's where, like, patients like, where can I get a small bottle? I can't find it anywhere. They sell them at the airport. Request a sample care kit from your doctor. Yes, sometimes we get them, sometimes we don't. I know we're out of Simplus right now. You could declare it, tell the TSA agent, this is perfectly legit per TSA because it's considered a medication. You declare it as an over-the-counter medication, bypassing the 1 quart bag altogether, and they will take it and they will take it back and run it through and you don't have to worry about it. Or pay to check your baggage. Just put it in your check bag. If you have a large bottle, it's probably the easiest thing to do. All right, this is something that, years and years of doing this, 30 years now doing this, and getting patients in from other practices. Mistakes made by your doctor. Number 1 is poor communication. I see it all. It's like you see patients not complying with their lens care regimen. They didn't know any different. Why? Because the doctor didn't tell them. I mean, I don't want to say the doctor didn't know. The doctor should know. They're not a doctor. Some doctors don't specialize in contact lenses. They might specialize in LASIK. They might do cataract surgery. That might be their thing. And contact lenses is not really what they specialize in. That's a possibility. They might specialize in glaucoma. So maybe they don't know. But if they say that they specialize in keratoconus, I would hope and I would think that they know what to tell you. But look at this study. This study showed 1/3 of contact lens wearers reported that they never heard any lens wear and care recommendations from their doctor. 47.9% recalled hearing no sleeping in contact lenses. Only half? And then only about 20% recalled ever hearing no topping off. That is something that's not good. That's using the same solution you used the day before. And if it's not all dumped out, you just add a little bit more. That's what led to these outbreaks I mentioned earlier. That's like taking a bath in the same bath water 2 days in a row. It's just not going to be as effective that second day. That's just not good. And most doctors are not mentioning this. So the conclusion from the study is that many doctors are not discussing lens care. And for those who do, the communication needs improvement. So how can your doctor improve? I give this lecture to doctors, and I've written, as you can see, quite a bit about it. It's important for your doctor to provide verbal instruction or through their technician, written information, video instruction, either in office or send you to a website. And then again, reinforcement at future visits. Every single visit, every single contact lens wearer gets asked about how you clean and care for your lenses on every visit, no matter what. They just do. And my technician knows how to ask it, and she's really, really good at asking it. And she corrects the patients right on the spot. And she's great at that, and she's kind, and people appreciate it, and they love her. So that's important. But, now that we all have websites, years ago we didn't, you cannot say as a doctor, just go to my website. Because you guys are patients. You know, if someone says, just go to my website, I mean, are you going to do it? Maybe, maybe not. So even though people aren't reading things on paper anymore, my kids sure aren't in their generation. They read everything on their phone or tablet. But I still like to give somebody a tangible piece of paper because they're more likely to read it. Verbal instructions is important. Everyone learns differently. That's why I like to hit on all 4 of these, because some people learn better verbally, some people learn better written, so they get both. And then hopefully they know what they're doing, and they do. My patients are awesome. Any of you in the crowd, you know that you're doing a great job cleaning your lenses. Second thing, mistakes made by your doctor is not hiring, training, and rewarding good staff. In 2004, a long time ago, oh my goodness, 20 years ago, I wrote an article in Contact Lens Spectrum entitled A Good Tech Means Good Care. And I know as a doctor that I would not be successful without my technicians. It just would not be the practice it is. It is so critical. It makes or breaks, a practice. It turns an average practice into a great practice if you have a great technician and vice versa. You will never be a great practice if you have a technician that tells patients, clean these, whatever, all the solutions are the same. Like I heard at that one office I was filling in at, I was shocked. As you know from this lecture, all solutions are not the same. They're all a little bit different, and your doctor has chosen them for a reason. So I find this critical. I hire good people. That's my number one thing. And then I train them, and I want them to be my right arm and communicate to you, the patients, the same way that I would. And then I reward them. So I just want to say thanks to my three technicians here who work up the patients, Kelly, Brittany, Callie. They do an awesome job. And they do an awesome job at insertion removal training their patient. And so I nominated them for the CLI Culture Award this past year, and they won. So that's something that's very important to me when I know how they are important to my patients and how important they are in this entire process, because they are. Um, I rewarded them. And then we had a big party, invited all of our friends and family, and had a great time. So this is something that I think, if there's any doctors in the audience, this is absolutely critical, is you need to listen to your staff as well. You need to teach them, and then you need to listen to them. And that brings me to my next slide. This comes from Brittany, my technician. I asked her the other day, what are the top mistakes patients make? You guys. She said, number one, filling their scleral lenses with the wrong solutions, either a large bottle, which has preservative, or something that's preserved. Secondly, sleeping in lenses. I already talked about the fact that scleral lenses are 3 times the thickness of corneal GPs. If you sleep in your lenses, you're allowing very little oxygen to your cornea because you're closing your eyelid over it. So it's a double whammy. And when you allow less oxygen to your cornea, blood vessels can grow in. And then if you ever have an infection, it is less likely to heal quickly because of that neovascularization. There's a whole bunch of issues that can happen sleeping in lenses. Just not a good idea. And then this was kind of an interesting comment. I didn't expect this from her, but this was pretty cool. Not realizing that there are other keratoconus patients out there just like you, and that there are great organizations like, oh my gosh, I have a dyslexia moment here, NKCF, to help. Yeah, so we tell patients about this organization, and we tell patients that there are plenty others like you. They know that. If I see 10 keratoconus patients a day, they'll be sitting with one in the waiting room, passing one in the hallway. Like, they know that. And I think when they come in referred in from other practices, or they're a brand new diagnosis, they may feel alone. And we want to make them know, no, right up front, you are not alone. There's lots of help for you, not just with your contact lenses, but also emotionally. We're here to help. So that came from Brittany. This is why she's awesome. This is why the patients love her. Lots of great resources online. And thank you. Sorry we went over a little bit, but I appreciate you sticking it out this whole time. And if you have any other questions, let me know.
Thank you again, Dr. Gromacki, for such a thorough and comprehensive lecture on the different solutions that patients can use. Again, our next webinar is going to take place on July 9th. It's going to be a Ask Me Anything type of lecture where all of you can submit questions on the NKCF webinar website. Just look for that in June. There will be a Google document there for you to type your questions in. And hopefully we'll see you on July 9th. Have a good night, everybody. Thanks again, Dr.
Good night.
Gromacki.